Breast and cervical cancers remain the leading cancers among women in Kenya, while prostate and oesophageal cancers are the most common among men, according to the National Cancer Registry's 2024 cancer report. The registry recorded 14,461 new cases, with 8,222 diagnosed among women and 6,225 among men. Speaking at the launch of the National Cancer Institute of Kenya Institutional Scientific and Ethics Review Committee, here the Cabinet Secretary Aden Duale noted that the government is prioritizing early screening, research and evidence-based policymaking to improve cancer outcomes in the country.
The National Cancer Registry shows that breast, cervical, esophageal, prostate and colorectal cancers accounted for 58.5% of all cancer cases reported in Kenya in 2024, with the burden rising sharply after the age of 40. Nyeri, Murang'a and Uasin Gishu counties recorded the highest cancer incidence rates, while the lowest rates were reported in the arid and semi-arid counties of Mandera, Turkana, Wajir, West Pokot and Samburu. However, the registry notes that the lower incidence in these counties may reflect limited access to cancer screening, diagnosis and treatment services, as well as gaps in cancer registry coverage rather than a lower disease burden. The report also reveals that nearly half of all reported cases lacked staging information, while 78.6% of patients with documented staging were diagnosed at advanced stages, underscoring the need for early diagnosis and timely treatment. Health Cabinet Secretary Aden Duale said the government is shifting its focus from treating advanced cancer to promoting early screening, diagnosis and community awareness.
We must reconfigure how we deal with cancer, the whole way of dealing with it. We should not wait for the patients now in the healthcare facilities. We must do diagnostic screening, we must do early screening, early detection, and we must do community sensitization.
The Cabinet Secretary noted that the newly launched Institutional Scientific and Ethics Review Committee will strengthen cancer research and ensure government policies are guided by credible scientific evidence.
Every decision we make within the healthcare sector affects a patient. So the decision must be made right, it must be evidence-based, and it must be done timely.
We cannot overemphasize the importance of having local research to guide our decision-making. And from a policy level, for us as the board and together with the ministry, what they need is to be sure that the decisions we are making are for the benefit of Kenyans out there.
Duale further challenged healthcare providers to make cancer screening part of routine medical care, saying every visit to a health facility should provide an opportunity for early detection.
We have a problem in our country. We must speak about cancer, and we must tell our citizens, and we must even make it such a way that any person visiting a health facility doesn't come out without a screening.
Jacqueline Masharia for Prime Edition.